of coming together, of reflection, and of love. This is a moment in which we are all called, not only to be there for each other, but to be here for all of humanity, to know that what unites us is much stronger than anything that divided us. And if we've learned anything through this crisis of COVID-19, it's what we share in common. Thank you, Los Angeles, for reminding us of that. While our celebrations may look different, we will each see each other one day back out in the open and know that we are all Angelenos, defined by our courage, defined by our love, and defined by our ability to care for one another at the most difficult of times. In our fight against COVID-19, we know one of the tools that we are using is our solidarity, that ability to think not just about ourselves, but about our loved ones and our neighbors and even strangers in the city who would be affected by our actions. But another powerful weapon that we've used from the beginning, that certainly I've used as your mayor, is data, looking at the cold, hard facts and the information that can inform decisions that can save lives. It helps us be able to track our progress. It helps us to be able to flatten the curve. It helps us to know at the end of this that we can look back and say more of us are still here than otherwise would have been. And tonight we're very lucky to have some new data. And we're joined tonight by Brianne Gilbert, who's the Associate Director for the Center for the Study of Los Angeles at Loyola Marymount University. Together with her colleague Fernando Guerra, as I've shared with you in recent weeks, they've been polling Angelenos across Los Angeles County, including Los Angeles City, to hear from us about how we're dealing with this crisis, our perceptions about this, the things that we are doing, and how this is affecting our lives. And I want to thank you, Brianne, for being here tonight, and we're looking forward to hearing from you and telling us a little bit more about the story that the numbers paint. Data on how Angelenos are staying safer at home, with 95% of those surveyed saying that they support the emergency order, or the scale of the economic loss in real terms that we can see numerically, or how folks think that coronavirus might impact them. All of these things are critical. And at the beginning of this crisis, I reached out to Loyola Marymount, knowing that the center had done amazing work on looking at the way we look at our city and each other, and I knew that this was information that could arm us with the right decisions to save lives. Before I turn it over to Brianne, though, let me run through the data that every night I share with you and that you need to know, and highlight the hope and the hurt and the pain, but the progress of this past week. Today in Los Angeles County, we marked 475 new confirmed positive COVID-19 cases, bringing the total to 8,430, a 6% increase since yesterday. This marks now the 5th day in a row of single-digit increases. As I said, I won't be happy until we have negative numbers, but in the meantime, this is a huge accomplishment that you have achieved through your discipline, through your love, through your adherence to these orders. We also know that this is beginning to bend the curve. That helps us be able to keep up in our hospitals, our emergency rooms, with our first responders who are out there, and so many people that are serving all of this city during this crisis. And that's why it's so critical to keep it going, to stay at home, to think about not going out whenever you can, and to making sure that we are practicing proper hygiene and physical distancing whenever and wherever we can. In the city of Los Angeles, we added 200 new cases today. That brings the total to 3,787, also a 6% increase. A week ago, there were 260 new cases and 2,047. So here too, we can see the rate of increase slowing. But as you can see, we're still doubling the number of cases and increasing the overall number who are positive. And of course, we keep adding to the most tragic statistic of all, learning that there were 18 new deaths as a result of COVID-19 here in Los Angeles County, bringing the total to 241, an 8% increase since yesterday, and up from just 89 last Friday. This has been a really hard week for us collectively and individually for those families who right now are in immeasurable pain. And our hearts always go out to you each evening, not just tonight, those of you who are suffering the loss of somebody who died in the last 24 hours, but everyone who has lost someone they care for here in Los Angeles. As we look forward to the future, we are seeing improvement, though. And the last several weeks, the number of deaths, as you'll recall, were doubling every 4 days. Now, the number of deaths are doubling every 6 days. Every life matters. We mourn each one of them. But the bigger that number is, that means the slower the deaths will be coming. And during this Holy Week, I hope we can all pray for those fallen souls here in Los Angeles. As we prepare still for the peak in our hospitals, we continue to very closely track what's going on in our hospitals. So let me report those numbers to you. In the county, our general emergency hospitals have 1,334 available beds, including 277 ICU beds, and an inventory of more than 1,096 to be exact, ventilators that are currently available for patients. Testing, we know, is absolutely critical to flattening the curve and being able to track where we are. And let me share with you how far we've come now. Last week, there were 12 testing locations across the city and county. Today, we opened up our 22nd location. And last Friday, we had the capacity to test 3,500 people, had tested 16,000 total. Today, across the city and county sites, we have the capacity to test nearly double that number, close to 6,000 Angelenos every day. And by the end of today, we will have tested a total of 37,000 plus people, more than twice the number from just a week before. And as I mentioned too, we're making sure that those tests are available to everybody. I want to remind everybody these are free. But as we saw worrying statistics, for instance, in our African American community, we doubled the number of tests available in the South LA site that we had. And we're going to be opening up a second walk-in center for the county. This one will also be in South Los Angeles to make sure nobody dies from COVID-19 because they don't have access to a test. It's more than 20,000 people this week that we tested, 4 times more than we tested in our first full week. So anyone now with symptoms, as I reminded you earlier this week, is now eligible. And you can go to coronavirus.lacity.org/testing to go to a county or city site near you. And even if slots are filled up for a given day, you will be taken to the next day that is available. And I always tell people, check in midday if you've been turned down. Oftentimes we see some people not show up in the mornings, and that opens up capacity in the afternoon. So that's the data I want to share. But before moving into tonight's other announcements, I'd like to hand it over to Brianne Gilbert, who's done extraordinary work. She's kept us in the loop. We've been able to share some of this, and I'm so grateful to her, Fernando Guerra, the entire community at LMU, for really helping us make sure we can save lives. Brianne, thanks for being here.
Thank you very much, Mayor. So over the last 2 weeks, our research team, the Center for the Study of Los Angeles at Loyola Marymount University, have conducted a survey of 2,000 Angeleno adult residents. We conducted this survey both phone and online in English and Spanish. Although we asked more than 30 COVID-19 related questions throughout that survey, we have just a few highlights that we wanted to share today. So right off the bat, as the mayor mentioned, we are seeing that nearly everyone, 95% of Angelenos, support the safer at home order. In fact, the largest percent say that the government's response has been just about right, at 59%, and then another 30% think that the government could do even more. We also found that residents are listening. Most Angelenos gave accurate answers to the ways to protect themselves and others, as well as the most common symptoms. For example, after the initial recommendation for wearing masks was given, the number of individuals who listed wearing a mask as one of the ways to protect themselves and others increased significantly. Unfortunately, though, nearly half, 48% of Angelenos have either been let go or had their hours reduced at work. Those most impacted are those individuals who are younger or who had lower incomes to start with. Nearly 1 out of 5 Angelenos do not have anyone they can depend on for care. We still need to reach out to our neighbors to make sure that everyone really does feel safer at home. Thank you, Mayor, for the opportunity to share a few of these highlights. Our full report will be available on our website at lmu.edu/studyla tomorrow morning. Thank you again.
Thank you, Bree, and thank you for the great work you've done. I know some of the reporters will probably want to ask some questions, but I just wanted to highlight what Brianne said, which is that 1 in 5 Angelenos don't have anybody to take care of them. Another statistic I've shared is that 50% of households have either somebody over 65 and or somebody with a pre-existing medical condition. So half of our households have folks that are most susceptible to dying if they get COVID-19. This is the sort of information that really arms us to make the right decisions, and I want to thank you for being here tonight and sharing that with the public. It is part of our vision to make sure you get information as quickly as we get it so you can make the right decisions to support and protect your family and your community. Let me make a few more announcements as well, and then we'll get into questions. Together with the Los Angeles County Department of Public Health, you probably heard the news today, and this is big news, that we are extending the Safer at Home order until May 15th. This was based on the advice of Dr. Ferrer. I want to thank her, Hilda Solis, who, as our supervisor, announced this together, and her colleagues who have done an extraordinary job on the Board of Supervisors of ensuring that our county workers have the resources they need to get us through this. This means that non-essential businesses and activities will remain closed. We will continue requiring physical distancing and face coverings for workers and customers. The City of Los Angeles has closed businesses and restricted public gatherings since March 15th. It's 26 days and counting. So this is a more than doubling down. And I know how tough it's going to be for a lot of folks who have hope with the numbers that I shared that we could be out of this perhaps sooner. As I've said from the beginning, when it feels wrong, it's the right time to do things. And I'm proud that Los Angeles moved quickly. By the time it feels right, it's too late. Or by the time that it feels right, it may be too early. We may feel like we want to go back outside, but as we're seeing in other countries that thought they were already through this, they're seeing dangerous spikes that are killing people. We're working very hard at plans where we can feather people back in. It's not going to be a flipping on of the switch and everybody goes back to work. It's more like a circuit board. Maybe some people can and some people won't. That said, I want you to hear from me that we won't have one day longer keeping you at home, but we won't let you out one day earlier than the public health officials tell us is necessary to save your lives. And now that we're seeing some progress, clear evidence that our collective sacrifice is working, it is time, as Dr. Fauci said, to put our foot on the accelerator. Now is the time not to let up. We got to keep washing our hands. We got to keep keeping our distance. We got to put our facial coverings on. We've got to resist the temptation to cross town or to leave where we are. And additionally, now, the county and city will require non-medical essential businesses that are open to the public to complete a social distancing protocol for each of their facilities. This is a form, as Dr. Ferrer mentioned, that every business that's still open will have to fill out. It will contain a checklist of social distancing, hygiene, and public health requirements to ensure that each business is implementing this order. The protocol document must be posted at or near the entrance to every business so that customers and employees can see that, no later than 11:59 on April 15th, at midnight, April 15th, April 16th. Copies of this protocol document, if you're a business that's still open, are available for download at coronavirus.lacity.org/distancing protocol. This physical distancing checklist is essential to the progress we will continue to make here in LA. So if your business, download it, take it seriously, spend this weekend, put the plan together, and make sure that you are implementing it. We all say that nobody's making greater sacrifices than our frontline workers. I wanted to ensure we're actually doing the work to save their lives too, to recognize their work and their sacrifice and how they're putting themselves in harm's way to make sure that we can continue. And that also includes our hospital workers. So I want to take a moment to directly speak to our doctors and nurses, to our medical assistants, and to our technicians and custodial staff, our janitors, administrators, everybody who's working in a hospital. I hope you've heard many of those stories and seen them all over the national news of the fear that people have, and yet they're still showing up with the courage that is in their hearts. I have no illusions about the sacrifices you are making, the strain that this crisis is putting on you. Some of you have left your families to make sure that they are healthy while you work. We love you and we support you, and we are indebted to you, but words of gratitude aren't enough. That's why I'm committed to making sure you have all the tools that you need, the personal protective equipment, the gear that you need to make sure you don't become another statistic in this fight against COVID-19. That's why tonight I'm giving you one more tool to help with the stress that you have. And we are launching the Los Angeles Emergency Childcare Connection, an initiative to support our hospital workers and their families to ensure that no essential worker misses a shift because he or she doesn't have childcare during this crisis. We know that many hospital workers across Los Angeles are struggling to find access for care for their children. And we know that's especially tough for lower wage folks and non-clinicians. We know as long as COVID-19 remains a threat, that all of our kids are safer at home. So we've partnered with hospitals across Los Angeles for this program to provide workers with 3 options for childcare. First, and the closest to home, is that you can apply for a stipend of $100 per shift and use the stipend to help pay for the type of childcare that best works for you. And wherever possible, we encourage you to use this stipend to help your kids stay at home or in the home of a trusted relative or neighbor. Participating hospitals must commit to making the full stipend available to all non-professional employees and prioritize low-wage workers. Second, you can get free referrals to licensed providers in your community. That means access to 3 high-quality resources for finding childcare. Carina Care, a web-based matching program aligned with our labor partners, SEIU Local 99. We Care, the nation's largest online private care matching agency, and referrals throughout the county. And third, beginning this Monday on April 13th, we'll begin providing care for kids between the ages of 6 and 14 at city rec centers in neighborhoods near participating hospitals. So if you don't have an option at home or in your neighborhood, we'll make sure you have one close to work and you know that your child is safe and close by. We're working to make it easier for you to keep your children at home whenever possible, but we know that's not always going to be an option. That's why these rec centers will be opened and staffed by Rec and Parks professionals who I want to thank deeply tonight for your work, 7 days a week, from 6 a.m. to 8 p.m. As you know, these are not regular work hours, but this is no regular crisis. And each center will offer programming and meals. It will adhere to public health guidelines. And while we're beginning with 5 locations, we hope to expand that as the need arises in coming weeks. So if you're in need of one of these programs, you should work with your hospital's HR department to connect with the right one for you, whether it's a stipend, a referral, or one of these centers. And I'm so grateful for everybody who's helped pull this together, the Los Angeles Childcare Alliance, the folks at Carina Care and We Care, SEIU, UHW, and Local 99, LAUSD, and our Rec and Parks staff. And I know that non-medical health workers are facing the same childcare challenges, and we are working around the clock to provide the solutions for you. We owe that to you because of what you are doing for us. I told you that government wouldn't stop working during this crisis, and we haven't. The most basic needs that we can meet are important to continue even in the midst of this crisis of COVID-19. And the most basic component for me has always been our streets. We're still filling potholes, we're sweeping our streets, repaving our roads during this crisis, but with so many people staying in their houses right now, we are reorienting because we have an amazing opportunity to do even more. So tonight, I'm announcing that Streets LA, our Bureau of Street Services, is shifting street paving and some major street sweeping from residential streets to our major corridors. With this change, our road work will have less of an impact on folks at home, and there will be less noise and disruption. And those main avenues you've been waiting to get paved, now is the time to strike and get that work done. These are projects on major thoroughfares that would ordinarily take far longer due to rush hour traffic and congestion. We're always stuck between people saying, don't do this during rush hour and do it quickly. Well, now we don't have rush hour and we can do it quickly. The condition of our pavement will improve. Commuters headed to essential jobs will see improvements and smoother roads, and our workers will be safer with more room to do their jobs. For more information, please visit streetsla.lacity.org/adapt. And when we talk about our streets, we're also talking about how Angelenos get around. And right now, we've been asking you to postpone whatever errands you can, even going to the grocery store if you can. But if you must make an essential trip, if you're out of food or close to, or you have to pick up your medicine, or if you're part of our essential workforce, like first responders, healthcare, and grocery workers, we want to remind you that Metro is still carrying riders every single day, 300,000 of them. And this is about a quarter of our normal ridership. So for anyone using Metro or any of our transit providers at this time, I want to issue this reminder. If you have to leave your home, please wear a face covering. For LADOT passengers, that is now a requirement. Please keep a safe physical distance on the buses, on the trains, and think about traveling earlier or later than usual to avoid some of the busiest times and to lessen that interaction with others. Doing this helps protect other passengers as well as our workers, and we've seen tragic stories across the country of those folks who continued to just do the basics, show up, help get you to work or to where you need to go, but who have been afflicted by COVID-19 and even some who have lost their lives. So I want to thank the members of SMART, ATU, TCU, AFSCME, and the Teamsters, our unions that represent an amazing workforce at LA Metro, and all the LA Metro employees who are working round the clock literally to continue making sure that this vital service is available to all here who need it. Tonight, let me update you finally on actions that have happened and donations to Los Angeles' response to the Mayor's Fund and other charitable groups that have reached out to help those in greatest needs. I want to thank an LA original, the producer, DJ, and all-around music impresario Mustard, for a significant donation that he gave to allow us to make sure that seniors are fed, that childcare is there for our healthcare workers, and that direct cash assistance to meet rent or to help folks get the basics like groceries is available. Thank you, Mustard. You're an amazing musician, and thank you for helping us tonight. On many nights, I give you an update on our campaign through mayorsfundla.org. And a lot of time I talk about the big foundations or amazing companies, individuals like Mustard, but it doesn't just come, this generosity, in 6 or 7 digit numbers. It comes sometimes in 1 or 2 digits. When people who are able to look around and see the need, even when they're in a moment of suffering, dig deep and give what they can. It was in that spirit that Scott Taylor from West Hollywood gave $20 because he remembers, and I quote, how generous everyone in LA was when things got hard for him, and he wanted to give back what he could. That same spirit we saw in Mercedes Tandre, who donated $25 because she realizes the untold impact we could all have on our city, and she felt compelled to make a contribution to those in dire need. We see that spirit in Selena Kingsley, who contributed $50 because her daughter-in-law is a nurse outside of our state who doesn't have a mask to protect herself at her job, and she knew that she could give something here and help a little to relieve the burden of someone here in the adopted city that I love. That's LA love in action. It's breathtaking to behold, and I see it every single day around the city. In the 20-something day of this is not let up. We're now more than 4 weeks into this, and our generosity seems to grow every single day. It's the same love that inspires a church in South LA to help about 100 single parents, the elderly, and infants who need basics like baby wipes, water, and cleaning supplies. It's that same love that drove the Studio City Neighborhood Council to step up and put together hygiene kits for their homeless neighbors. The same love that Friends of West LA showed as they provided 1,500 meals for our LAFD and LAPD first responders and 250 meals for medical personnel at UCLA. It's the same love that led us last night to light this building blue, along with landmarks across Los Angeles, something we will do through the end of April to say thank you to not only our healthcare workers, but our first responders and grocery workers and everybody who is working in an essential industry. That blue represents you, and our thanks for what you are doing. That LA love leads us and will guide us to each do our part, to save lives, to stop this virus, by our commitment to stay healthy, to stay safe, and to stay at home. As always, I wish you all much strength and much love, Los Angeles. And with that, I'm happy to answer questions. Thank you.
Our first question comes from the line of Jory Rand with ABC 7. Please go ahead.
Hi, Jory.
Hi, Mr. Mayor. Happy Passover and happy Easter to
Thank you.
Los Angeles on behalf of everyone at ABC 7. That street initiative, I think a lot of people will be happy to see work getting done. Have you talked to anyone on the state level about maybe getting some freeway projects done while there is less traffic on the road right now? I also wanted to clear something up on a question I asked you yesterday about testing. I just wanted to confirm that the number of confirmed cases of coronavirus, those are only coming from the PCR nasal swab test. And you mentioned test capacity rising. I'm curious about the backlog of processing of those tests statewide. The backlog has gotten smaller, but as the number of tests continues to rise, is there concern that the backlog might go back up? And finally, before we head to the weekend, last week I asked you about your dealing with the federal government. I just wanted to circle back around on that. Have you had to deal with the federal government at all anymore? Yesterday you called for leadership out of Washington on certain issues. And how do you feel about the firing of Inspector General Glenn Fine, who is overseeing the stimulus money being handed out? Thank you.
Sure. I think I count 7 questions, and I'm going to try to get to all of them quickly, Jory. Thank you so much. So the state, no, I haven't talked to them. I spoke today. I joined with the 13 large city mayors in a direct Zoom meeting with Governor Newsom to thank him, to ask him for certain things. We didn't, but I will, because I think it's a great idea for the state to also look at freeway projects and infrastructure projects in general that we can accelerate to keep people working and to get people back to work. So thank you for the suggestion. It's a great one. In terms of the tests, they are all virology tests. They're not always done with a nasal swab. Sometimes now they can be done with a swab inside your mouth, but they are not blood tests in the numbers that we are sharing with you. Some serology or blood tests have started. Right now, they're mostly being done to see incidents of people who have had COVID-19. But as I said, those tests don't necessarily always say whether you're infectious right now. You could be asymptomatic, be carrying it, and a blood test won't show that. So that's more to see who has had it, and those aren't in those statistics. So serology tests, which are blood ones, virology tests, these are only the virology tests that talk about whether you're infectious right now. In terms of the backlog, yes, I do understand it is getting better. We've been very blessed here. When we stood up our own testing in the city and then joined together to open that aperture up to locations in the county, hand in hand with the county, all of those we did with labs which we directly had the agreements with, and we're getting them back generally in 1 to 2, sometimes maximum of 3 days. So the 6, 7, 8 day delays that we are seeing in many of the labs that were out there is slowing down, is speeding up. We're seeing more of the small and medium-sized labs that used to do these sorts of tests, but for other diseases like HIV, converting their equipment. So I think there's a lot more that's come online. We're usually getting those answers more quickly, and we need those answers quickly. 1, to chase down all the contacts that somebody has had and to inform them so they can quarantine. 2, to make sure we can get treatment to people quickly so they know what they have and make sure that they can get the best medical advice. So that's absolutely critical. In terms of the federal government, yes, I'll talk about Inspector General. I think it is so important for us to have oversight of this federal money. We saw in 2008 that when we do giveaways to big industries without oversight, this money needs to go to average Americans. And that's not to say that companies aren't important for that. Many of us work for those corporations. But if it's given there and there's no oversight and we can't see how people struggling to make the rent or struggling to get the most basic needs are getting money or not, I think it is a tradition in this country to make sure that we have at least 2 or 3 eyes on that. When money is spent this quickly, my worry is that that can sometimes be abused. So absolutely, I support having an Inspector General there. In terms of my contacts, I had a couple conversations today. I spoke with Senator Kamala Harris today. As I mentioned, we had a conference call with the governor, and I had a long conversation this morning with Nancy Pelosi, where I talked to her about the need not just to reimburse costs for cities, but also to give fiscal direct assistance to cities, many of whom around the country are looking at furloughs, potentially layoffs, cutting services, and would be part of kind of a decline of the economy, that if we don't have city governments working, being able to pay their employees too, we could see that go off the cliff. And these monies are often shared with our communities. I also asked her to think about what we need to have sort of a CARES Corps at the national level, something that you'll hear me talk a little bit more. But this would be, hundreds of thousands of Americans, just as we've had a Peace Corps or a Teacher Corps, that would stand up alongside public health agencies to help them reopen the economy by having those blood tests and by chasing down contacts and tracking cases. Right now, Dr. Ferrer and her incredible staff members, every single time we say a number, 450 or 550, that seems like an easy number just to say. They have to call each one of those positives, ask them who they've been in contact with in recent days, and then contact each one of them. It's a Herculean task, and we will not get our economy back to work until the United States has a way to fund and maybe provide jobs to folks who are out of work, an army of these public health professionals who can do good work. So I think I hit everything there, Jory, and thank you for your good wishes. Happy Easter to you as well, and happy Passover to everybody. With that, let's go to the next question.
Next, we turn to the line of Alex Michelson with Fox 11 News. Please go ahead.
Hey, Alex.
Hi, Mayor. Unlike my friend and former colleague, Jory, I'm not going to ask you a 45-point question. But let's talk about the issue of the economy. You hear
Yes.
50% of Angelenos either out of work or with their jobs cut. People are desperate to get back to work. What if somebody like the president tries to bring the economy back together, and then you say no? Who's in charge in terms of the orders?
So a couple things. I appreciate what you're saying. 111,000 more unemployment claims just in the city of LA. Okay, sorry. I think there was a second question there, but there's 111,000 new Angelenos we learned just in the city of LA. That's not even the county that filled out unemployment claims. That's a total of over 160,000 now, just in the city of Los Angeles alone. So who's in charge of that? We will ultimately be in charge of that, as we've had to be for so many of these decisions. We will make the decision based on what's on the ground here and the local input. Where the federal government could help us a lot is by establishing the standards. For instance, OSHA tells us how to be safe in the workplace. We need to develop a whole set of rules for how to be safe with COVID-19 when we find out what percentage of people actually have carried it and maybe have the antibodies. That could be 10%, it could be 20%, who knows? But for the remaining 80 or 90%, we need rules for how we can safely return. We need guidance and funding to fund people like the CARES Corps idea that I have. These things are really important, but ultimately we will be in charge of those decisions. We will make that in consultation as a region, other mayors, the cities and county together, other counties around us, and together with the governor. Because at the end of the day, this is going to be up to us to restart the economy, to reinvest in the economy, and we need the feds to act faster and give deeper aid. It has not been enough. It has not come quickly enough, whether that's to individual Americans or to businesses. For people not to feel like they are free-falling. Do that job for the next month or two, and we can together, I think, look at how we reopen this economy and leave it to local governments to be able to do that in the best way possible. Thanks so much, Alex. Next question.
Next, we turn to the line of Robert Kovacic with NBC. Please go ahead.
Hey, Robert.
Mayor Garcetti, how are you, sir?
Good. Yourself?
Fine, thank you. Let's talk about the USNS Mercy. We've got more people on that ship that are sick, that have tested positive. Newsom today, the governor, said that he intends on taking nursing home patients and transferring them there. So with that said, curious about the state of that floating hospital and your opinion about what should be next. And also, we are heading into this weekend. We have indications that some people want services to go on, wondering what you and the Archbishop have conferred about, and just the idea that we're heading into a weekend where there could be very nice weather. We do have a holiday weekend upon us, and the idea that people are going to be inclined to not only go out, but to also gather.
Absolutely. Well, let me start with that. I remind everybody our parks will be closed. Same thing in the county. They will not be open on Sunday for Easter Sunday. It's a brutal decision to have to make, given how much love we all have for going out, having a post-church picnic, doing Easter egg hunts, but these activities can kill people, can take lives. And so I think the best way to celebrate Easter is to stay at home. Second, overwhelmingly, all the churches we've talked to are going to provide services, whether that's online, through a phone call. They're going to check in on people, but getting together is prohibited. That is something that cannot be done. There's creativity where people have gotten in cars and driven to locations around the country and kind of been in a parking lot. We're discouraging people from leaving your house at all. And the Archbishop was very clear about that as well. We've been in contact. Catholic churches will not be open. No churches will be. And any churches that we have seen that are still conducting services, we've called up, we've visited, and made sure that they know they need to be closed down. We've seen dangerous, dangerous examples of this that I shared last night. In Kansas, how church services were the biggest spreaders. In Chicago, there was a funeral that happened and a church service in which literally passing the plate and getting together at a funeral was one of the biggest super spreader events. We cannot afford for more people to die. We are doing well, so absolutely, make this a special Easter. Pray, commemorate it, listen to it. Join a service in a virtual way, but do not go to a church. They will not be open. Second, in terms of the USNS Mercy, yes, I think all of us want to see that continue to grow its capacity and expand. The governor did brief us on that in our call today, our Zoom meeting, that they are looking now, working with the county at some of the spillover that we could have in there from senior homes. There are, I think, 3 confirmed cases that were on the ship. Those are out. People are being tested to make sure that that is contained on the ship. In the meantime, there still are patients that have gone there. I think they started from our VA hospitals. But it's going to be a really important part of our arsenal. The good thing is we have some days until we're there. Right now, we haven't hit the peak, whether it's there or the convention center. We're building capacity. But in the ideal world, we won't have to use that capacity. But I will not be the mayor who said, oh, we should have done something, and suddenly people are dying in hospital hallways by themselves because we didn't do that work. And I want to thank the hospitals. Those numbers I give each night, which are relatively stable, 1,300 to 1,500 beds available, 900 to 1,000 ventilators, it's not because nobody's coming in. More people are coming in, but they've done a marvelous job of building capacity that at least equals all the new folks that have come into those hospitals. And that gives us a lot of hope for the days ahead. Thanks, Robert. Next question. And remember, Brianne's here if you have any LMU questions. Go ahead.
And next we turn to the line of Jim Roop with West One News. Please go ahead.
Hi, Jim.
Thank you very much for taking our questions. A question for you, and then is Ms. Gilbert still there? I'd like to ask her a question.
She is, yes. I've been hoping somebody would ask her a question. Go ahead.
For you, you talked about yesterday, I think it was yesterday, you mentioned Singapore and China, and when the restrictions were lifted there, now they're seeing sort of this second wave coming. So let's say on May 15th, things look good enough, and you decide, okay, let's lift some restrictions now. What does that look like? Is there a priority lifting list, if you will, and then would there be conditions on those liftings, if you have that plan in place, or if you're working on that? And then for Ms. Gilbert, something very interesting you said. I think you said nearly 40% of those you polled said the government could do more. What did they suggest could possibly be done more by our government? It seems that they're doing everything they possibly can. Were there any suggestions made, or were any questions asked, well, what do you suggest should be done more? Thank you.
Brianne, do you want to take that one first?
Sure thing. So we did find that 30% said that the government could do more. We saw 24% could do, I think it was a little bit more, and then another 6% do a lot more. We didn't have the opportunity to do another follow-up question to dig into the specifics, but that's always good food for thought should we end up doing another survey. But thank you for your question.
And we certainly have heard anecdotally what people say government can do more. We could have a lot more testing. We could have that funded from Washington. We could have had more ventilators, more PPE. So I think we all know that there's more work, and I take that responsibility collectively. I have from the beginning of this. I have never waited for the cavalry to come, but it showed that the overwhelming majority said we're doing what's the right amount. A few said we are doing too much, and then others, about 20%, said you could do some more, and a few a lot more. So it would be interesting to do follow-ons with those, but we're getting anecdotally that most people are, I think, are most frustrated at the slowness of testing nationally, and I think that was something that was probably reflected in the poll. In terms of the first question that you had about Singapore and China, so there is no master plan. There's no secret room that we're all in day to day, and one day we're going to tell you what the plan is. We're listening right now to health professionals here, and we're interacting with folks around the country and the world, especially those places in the world that are further ahead than us. I think I shared with you that I've been in contact with mayors around the world, from Korea, from Italy, from Spain, from other places, to learn how they are going to do that. For instance, Austria is talking about opening up restaurants in a week or two. Denmark, these are places that had the onslaught earlier, so it's not that they're going to open up in fewer days than us. They're just doing it potentially earlier. And we're going to watch what they are doing and how they're doing it. I think that's really something amazing for Los Angeles, because we were able to take action early, and we had our incidents later that we can actually watch and learn from the best practices that are out there. But I would just remind people, it's not going to be a single day where whole industries or everybody's going to come out. It'll be bit by bit. And it will depend a lot on our ability to stand up two things: those serology and blood tests, and the ability to track and trace cases. Because we know that the majority of people, or we pray, and it looks that way, that a majority of people will not be COVID-19 positive by the time we're able to bend that curve all the way down. That still means we're susceptible to COVID-19. And if we do this wrong, we could have an outbreak and many more people could die than we're seeing right now. I know that's what makes this frustrating. People are like, we're doing such a good job. Isn't there a reward? The reward isn't getting out right now. The reward is knowing that people aren't dying and knowing that we have to stay with that. So we will continue to consult with cities around the region, of course, following Dr. Frere and the county's recommendations, but know that we're not just waiting passively. I'm having conversations this weekend with experts in the economy, healthcare sector, some of the main doctors that have begun to talk about this, and I hope to put some of my ideas out as early as the beginning of next week on what it would require at the national level for cities like Los Angeles to begin to get back to work in the coming weeks and months. Thanks. Next question, please.
Next, we turn to the line of Steve Gregory with KFI News.
Hey, Steve. How you doing?
Hey, Eric. Good evening. And Brianne, quick question for you on the methodology on this. Was it just people in the city proper of Los Angeles? I didn't catch that, or was this county response in addition to that? Also, how many questions did you ask? And Mayor, then with respect to the survey itself, was there anything in there that really surprised you, something that jumped out at you, something that you didn't expect to see?
Go ahead, Britt.
Okay, so going back to the question, first of all, methodology. Our Center for the Study of Los Angeles is a member of the Transparency Initiative, so if there are any questions about methodology at any point, we're happy to answer them. But that's an easy one. The questions were asked county-wide, so we surveyed 2,000 adult residents, so not just voters, but looking at specifically at residents throughout the entire county. There were 1,000 in the city of Los Angeles. We did a small oversample there, and then the other 1,000 were in the county that was not part of the city of Los Angeles. So,
and then
we asked a total of 34 questions, but many of those questions had multiple components or multiple sub-questions. And then our entire survey and all the responses will be available on our website tomorrow. So I know typically we release, many research centers release their results piecemeal, but for this, we wanted to make sure that the public had the data as quickly as possible and had the full scope of what we asked. So every question crossed by every demographic question that we asked will be available at lmu.edu/studyla. Thank you.
Yeah, sure. You know, there was certain things that jumped out at me, even if they didn't surprise me, and certain things that surprised me. It didn't surprise me, but it jumps out that half of Angelenos either had lost their job that were working, lost their job, or had their hours cut. And that was, I think, even in the first couple of weeks. I mean, that was instantaneous. So the severity of this, which I think we all felt, just to see that number certainly jumps out. I was surprised by the number of people who still said, go to a doctor if you have any symptoms. It was about a third, 2/3 knew to basically take care of yourself unless the symptoms were severe. And that's something we have to continue to help people, because we didn't want to rush on our emergency rooms or our hospitals where people could get sick, when, as we've seen with our testing, over 80% of people who get tests, even if they have symptoms of something else. They're not sick with COVID-19. And so we wanted to make sure that they were safe. Also, I think we shared this a little earlier, but how many people don't have somebody to take care of them. I would have never guessed that 1 out of 5 people have no one to take care of them. And the other one that I shared, that half of our households have somebody in that vulnerable population of either being a senior and or somebody who is medically compromised. Those were the most, I think the most kind of the strongest numbers that came out. But there's a lot, and I do hope folks look at this, because there's a lot of detail and crosstabs by communities and some geography too that are very important to see. Next question, please.
Next, we turn to the line of Claudia Pashuta with KNX News Radio. Please go ahead.
Hey, Claudia.
Hi, Eric. I'm wondering what the impact of the coronavirus has been on the entire city workforce, what the total number of cases is, how many city employees may be hospitalized, quarantined, or isolated, and whether there have been any deaths. And then also last night you announced the mobile testing program for nursing homes and other facilities. And I wonder if there's any chance that mobile testing might be extended to people who live in their own homes but also have a hard time getting around and may not be able to get to a testing site.
Yes.
Thank you.
So for that one, thank you for the question. We are working with doctors that do those house calls to seniors and others. So absolutely, that's actually been in place, I think, for over a week and a half now. It's not universally available to everybody. Again, these are for cases that qualify, but we've worked with the networks of doctors who work with seniors who are homebound, as well as those that are in senior homes. So absolutely, that's there. In terms of the numbers of cases in the city of Los Angeles, our workforce, I actually have that. Let me try to get that to you before the end. I don't have it here in notes. I do have Los Angeles Fire Department. We have 15, 14 sworn and 1 civilian, 5 of which have returned to duty, 1 of which is in the hospital. LAPD cases, we have 52, 40 sworn or police officers and 12 civilians, 10 are returned to duty and 2 in hospital. And yes, unfortunately, among the fallen are city employees. That is not, the people are not public yet. When families allow us to, we'll share that information of 2 people that I believe right now have died who are city employees. So this is touching everybody. And as I said, it wasn't just lip service that these were going to be tough days. I said these were going to hit us. They're going to hit the people we work with. They're going to hit our families. They're going to hit our neighbors. And we are still in that period. So I love sharing the news of the progress we're making, but it saddens me deeply that we have lost from our own city family. And I know so many biological and residential families have the same suffering going on right now. I think that was the questions. Next one, please. Thank you. Next question.
And next we turn to the line of Adrian Florido with NPR. Please go ahead.
Hi, Adrian.
Hi, Mayor. Thanks. The outbreak at a homeless shelter in San Francisco today sort of showed us how quickly this virus can spread in these congregate settings. 68 out of 100 people staying in the shelter tested positive. So given that you can't provide a hotel room to all of the city's unhoused people, and given the magnitude of this outbreak in San Francisco, have you thought at all about whether it's still a good idea to encourage people to come to these shelters that you've opened across the city? Yeah. In terms of a risk sort of contagion sort of point of view, what's your assessment as far as whether people might actually be safer on the streets than coming to these shelters? And then sort of on a related note, can you give us the latest figures on positive cases among the homeless population, and also how many hotel rooms are currently available today for unhoused people?
I have those stats too, but I'll see if I can get them for you. Couple things. One is this has not been our idea. We took the direction that was given to us from public health, and we'll stick to that as long as that is their advice. And here, unlike what we saw up in San Francisco, and I don't know what the spacing was up there, I don't know what the issues were, we took folks that were sometimes in tighter congregate shelters and spread them out, and folks from the street and brought them in more spread out than sometimes they were living on the streets and coming into contact with many more people. By having folks checked for temperatures twice a day, of course, before they come in, by having medical personnel right there where they are living, I think all of us still remain convinced that it's safer to have eyes on, medical assistance, proper spacing, food, PPE, and all of that in those congregate shelters that we've set up. That said, I would love to continue to see the hotel and motel rooms. We're over 1,000 of them in what's called Tier 1. This is for individuals who are not COVID-19 positive. And I'll get you the exact numbers of how many of those are filled right now. I think 1,000 plus have inked the contracts. About 500 of them are already online, and I think about half of those are filled. So around 250, 500, and 1,000, but I'll double check those for you. Then there's Tier 2, which is for individuals, whether you're homeless or not homeless, to go into hotel, motel rooms for individuals who can't find some place in their own home or don't have a place where they can quarantine, and others who can go and be isolated. And I believe there's 40 of those cases now of people experiencing homelessness. There are 50 of those rooms filled, a majority of which are people experiencing homelessness, but not exclusively. So I don't have a breakdown of those 50 between whether it's 30, 20, but I know a majority of those are people experiencing homelessness. The biggest thing where we can continue to get help is in the staffing up of these hotels and motels. All sorts of folks have said, great idea, advocates have pushed for it, seize these hotels and motels. I mean, we still have to pay for things, and that's important to remember. But you can't just put people in a place without medical professionals and people who have needs. You have to actually find the individuals in a very stretched, thin homeless services environment right now, who are the mental health professionals, the substance and addiction specialists, people who can help with childcare and other things. So we can't find those people quickly enough. As I mentioned 2 days ago, we've put somebody who's kind of a czar on this to be able to sign more deals with more hotels, John Vane. And we're looking forward to seeing more people go into there. Right now, we can expand to more congregate shelters, but right now it's on hold until we continue to get that advice and see if the hotel rooms expand more quickly. That's maybe a smarter place for us to go. Thanks for the question, Adrian. And I'll see if I can get you the exact numbers as a follow-up. Next question, please.
And our final question in English comes from Maeve Reston with CNN. Please go ahead.
Hey, Maeve, how you holding up?
Hey, Mayor. I just wanted to follow up on what you were asked about earlier in terms of President Trump's desires to reopen the economy. How have you and your team been thinking through what levers of enforcement you would have in terms of, if you still had a stay-at-home order in place here, but other Americans were just allowed to sort of roam the country freely? Have you been thinking through airport checkpoints and, driving checkpoints? How are you sort of preparing for that possibility at this point?
No, let me just say it would be very dangerous if we had as uneven as we've seen in states across the country in terms of who had safer at home orders and who didn't. As dangerous as that was to so many places, it would be equally dangerous for us to see a different set of standards in different parts of the country. And no, we will fail. We're not going to be able to build a wall around Los Angeles or California. Plane flights would be the last thing. They can't put enough people on the border to not drive back and forth. This really requires national leadership, and it requires for us all to have one single voice. So I think we all want to see the economy go back, but it's a false choice between health and the economy. The best way to help the economy is to make sure that we have the public health side taken care of. And the best way to save lives is to make sure that we don't open the economy early. So, this is something that will require national leadership. It is not something that we can wall off, keep away, enforce at gunpoint. Those things would be ridiculous. It's important for us to raise our voice now to say, look, the aspirations of our heart should not guide our decisions. It should be the advice of medical professionals. And if you want to get the economy open, Mr. President, Congress, any mayor, do the work of getting the public health professionals who can track and trace, get us the tests so we can have the blood tests to know who's immune and who's not, and the people who are not can properly distance and potentially work in environments with new rules that this federal government could then promulgate and write. So those things, I think, are much more important than getting into some sort of a fight. As we've seen, these fights help nobody. Fights kill people. But listening to your medical professionals and listening to your local officials is the best way to find nationally what we should do. I told mayors across the country, you should be doing stay-at-home orders even if you don't have a single case, because it's coming. And many of them did. And I'm so proud LA has led. We are ready to follow, but that requires leadership at the national level.
Thank you.
Thank you. Okay. Well, let me thank Brianne again. I look forward to that website one last time, Brianne, for...
So www.lmu.edu/studyla.
Awesome.
Thank you again.
Thank you for all that you have done. I'm going to switch into Spanish and let Brianne exit. Thank you. Have a good weekend and a good Easter. Muy buenas tardes, Los Ángeles, y gracias por venir. Hoy es Viernes Santo y estamos en medida de la Pascua judía. Y el domingo muchos celebrarán la Pascua. La comunidad Sikh celebrará Baisakhi en domingo también. Pronto, y el mes santo de Ramadán empieza también en 2 semanas. Y mientras celebramos de manera diferente este año en cada comunidad, cada angelino está aceptando este momento con amor, generosidad y coraje. Gracias. En nuestra lucha contra este virus, los datos son una herramienta crítica para nosotros. Aquí están los datos de hoy. Hoy hubieron 475 nuevos casos en el condado de Los Ángeles, llegando a un total de 8,430. En la ciudad tuvimos 200 nuevos casos, llegando a un total de 3,787. Y tristemente, hoy fallecieron 18 personas más en el condado, llegando a un total de 241 fallecidos. En nuestros hospitales Tenemos 1,334 camas disponibles. Entre ellas, 277 están en las unidades de cuidados intensivos y tenemos 1,096 respiradores. Hoy abrimos el sitio número 19 para hacer pruebas de detección y hicimos pruebas para casi 6,000 personas en nuestra ciudad. En total, al final de esta semana, habremos hecho pruebas para 37,000 personas. Si tienes síntomas de coronavirus, visita la página coronavirus.lacity.org/testing para hacer una prueba de detección. Juntos con los oficiales del condado, estamos extendiendo la orden más protegidos en casa hasta el 15 de mayo. Lo siento mucho por esta acción. Esta es una noticia triste, pero esto significa que las empresas no esenciales se quedarán cerradas. Mantendremos las prácticas de sana distancia y de requerir que trabajadores y clientes lleven coberturas faciales. Este es crítico. Nosotros podemos continuar a salvar las vidas y el aviso del Departamento de Salud Pública es a continuar hasta mayo. Cerramos nuestras empresas el 15 de marzo hace 26 días. Fuimos la primera gran ciudad para hacerlo y aunque ha sido difícil para nosotros, no tengo duda que hemos salvado vidas. Ahora, nadie está haciendo un sacrificio más grande que nuestros trabajadores en la frente de todo, incluyendo los empleados en nuestros hospitales. Les debemos todo y por eso estoy anunciando hoy el lanzamiento del programa LA Emergency Childcare Connection, una conexión de cuidado para nuestros hijos, para apoyar a familias de nuestros trabajadores en hospitales con acceso más fácil a cuidado infantil. Hemos colaborado con hospitales locales para ofrecerles lo siguiente: un estipendio de $100 para cada turno para ayudar a pagar el cuidado infantil, que es más fácil para ustedes. Sin embargo, les alentamos a usar esto para que alguien llegue a su casa para cuidar a sus hijos, donde están más protegidos. Segundo, ofrecemos referencias gratis para proveedores en su comunidad para encontrar cuidado infantil de alta calidad. Incluye Childcare, WeCare y otras referencias en el condado. Y de último, empezando el lunes 13 de abril, estaremos abriendo 5 centros de recreación en la ciudad para ofrecer cuidado infantil gratis para niños entre las edades 6 y 14 por los trabajadores en nuestros hospitales. Estos centros estarán abiertos 7 días a la semana, entre las 6 de la mañana hasta las 8 de la noche. Si necesitas estos servicios, por favor, comuníquese con el Departamento de Recursos Humanos de su hospital. También hoy estoy anunciando que Streets LA está cambiando su enfoque de trabajo de pavimentar y limpiar las calles a las calles mayores para evitar el ruido en las calles residenciales. Para más información sobre estas obras, visita la página streetsla.lacity.org/adapt. Y también quisiera recordarles que si tienen que salir, por favor, usen sus coberturas faciales y mantengan la sana distancia en buses y los trenes. Cada acción cuenta. Cuando toman estas precauciones, tiene un impacto en la salud de todos. Finalmente, les recuerdo que si pueden contribuir a nuestro fondo Mayor's Fund, cada contribución puede ayudar a alguien quien está enfrentando dificultades económicas en momento. Si pueden donar, por favor, visita mayorsfundla.org para contribuir. Quédense en buena salud, quédense protegidos, quédense en casa. Fuerza y amor. Y preguntas en español. Gracias. I'll take questions in Spanish. Thank you.
And our question comes from the line of Abel Alamido with Telemundo 52. Please go ahead.
Hi, Mayor. My question is, what's your message to Angelinos who might be frustrated with the new Safer at Home extension?
Mi mensaje a la gente de Los Ángeles, estos son tiempos muy difíciles. Me siento esto. Y mientras vemos señales que nuestro trabajo para aplanar la curva está funcionando, todavía tenemos que mantener estas acciones, nuestro cumplimiento con la orden de quedarnos protegidos en casa. Y esta es la razón. Este no es un orden solamente de un alcalde o de la ciudad. Este es un orden a proteger su vida y las vidas de su familia. Los profesionales, los doctores, son mi guía. No los políticos, no mis amigos, pero los doctores, los expertos. Cada día yo hablo con doctora Ferrer y otros doctores que puedan dar este aviso. ¿Es tiempo ahora? Necesitamos más, necesitamos diferentes acciones o órdenes, y mis acciones son el resultado de su aviso experto. Y yo quiero tener la vida del pasado muy rápidamente en el futuro, pero necesitamos tomar estos pasos. Y por la gente que quieren acelerar estos días, quédense en casa. Tenemos la evidencia de otros países como en Singapur, en China, donde las victorias de enero y febrero desafortunadamente han resultado en nuevos casos ahora. Necesitamos tomar pasos con mucho cuidado. Y por eso estamos trabajando muy duro con los expertos a establecer un sistema, especialmente para las pruebas de sangre. Por eso en el futuro nosotros podemos regresar a nuestros trabajos, regresar a nuestras escuelas, pero necesitamos la ayuda de Washington y otras para estas pruebas y un sistema de personas que puedan no solamente dar estas pruebas al público, pero también para encontrar los casos y la gente que ha estado con estos casos, porque este es nuestra arma más poderosa. Y mi idea es tener un grupo, se llama CARES Corps, de empleados de la ciudad, del condado, voluntarios y nuevos empleados, personas sin trabajo, a establecer este grupo, a luchar no solamente por este momento, pero a regresar al futuro. Gracias. Any other questions in Spanish? One other thing for those who are still tuning in, let me give you the project room key numbers. Thank you to my crack staff for getting them. There's actually 22 leases now. The numbers went up since I was briefed earlier. There's 1,746 rooms total that have now been signed on. 942 of those are in the city of Los Angeles. The other half, roughly, are in other parts of the county. And as I said, we'll try to get you the numbers of how many of those are filled. I believe it was earlier today that about 500 of those are online, and half of those were filled. Okay? I wish you all a wonderful weekend, a good Good Friday and Easter, Baisake. To everyone who's out there, thank you for your strength. I'm sorry to bear bad news, but I will always share news with you as quickly as I have it. And I always believe that we will march through this together, and we will get to a better day soon. Thank you, and God bless you all.